Welcome to our CARE Act eligibility and practice training. Today we are going to share information about CARE Act eligibility, including recent updates made due to Senate Bill 27, which will be effective January 1st, 2026. So today we'll have two presenters from Health Management Associates, Rachel Johnson-Yates and Dr. Deborah Rose. We're going to describe the CARE Act eligibility criteria, talk what that looks like, also discuss a case example, and then we're going to talk about key process points in which eligibility is reviewed and how it's assessed and documented. Some learning objectives for today is that you will better be able to describe care eligibility, including clinical diagnosis and other eligibility criteria related to impact on daily living, and also identify key inflection points for assessing and applying eligibility throughout the care process, including the petition, the county report, and the clinical evaluation. So with that, I'll turn it over to my colleagues to start the discussion on CARE Act eligibility.
Thank you, Patricia. You can go ahead and go on to the next slide. In today's training, we are discussing eligibility, and we wanted to start off by giving just a brief overview of the care process and to highlight that there are several points throughout care in which we are evaluating eligibility, both formally and informally. And here on this diagram, you can see the various points in which we are checking to make sure that the person that we are serving does in fact meet the eligibility criteria so that we can ensure that we are serving the person in a manner that is the best fit for them at the time that they are engaging in the care process. Next slide, please. And so to illustrate what we're talking about today, we will be using this vignette to demonstrate how eligibility plays out for a person involved in care. So let's meet Ming. Ming is a 42-year-old single woman who's enrolled in outpatient behavioral health where she's been diagnosed with schizophrenia. She enjoys painting. She's currently living in a board and care, but has been having increasing instances of disappearing for days at a time. We know that she at this point has stopped taking her antipsychotic medication, and she's had a few instances, like recently she was brought into a psychiatric emergency department by police who found her to be threatening others on the street, appearing to be overtly paranoid and having symptoms of psychosis. The team at the psychiatric emergency department determined that Ming could not be held on a 5150 as she was not an imminent threat to herself or others, and she's not gravely disabled as she has a place to live and she's able and willing to return there. In the emergency department, she did take her antipsychotic medication and stated that she would follow up, though the ER staff were feeling a little bit skeptical about whether or not she would be able to follow through. She has been having progressive symptoms of paranoia, has been doing things like accusing her caregivers of stealing from her and controlling her thoughts. And her caregivers are very interested at this point in referring her to care. And so we know that Ming may be eligible for care because of her diagnosis of schizophrenia, which is an eligible diagnosis under care. But we have to learn a little bit more about her to assess whether or not she meets the full eligibility criteria. Next slide, please. So the eligibility criteria for care, it has to consist of all of the following. So the person has to be an adult, ages 18 years or older. The person has to be experiencing a current severe mental disorder as defined by California code. And it needs to be a diagnosis of bipolar 1 disorder with psychotic features, schizophrenia spectrum disorders, or other psychotic disorders. The symptoms need to be severe and persistent, interfering with daily functioning. And the person needs to be not currently stabilized with ongoing voluntary treatment. And so they may be engaged in treatment, but that treatment so far has not been enough to get them feeling stable. We want to make sure that participation in care is the least restrictive alternative for that individual and that they are likely to benefit from participating in a care plan or care agreement. So in addition to all of those things that must be in place, there needs to be at least one of the following in place as well. And it needs to be that either or they are unlikely to survive safely in the community without supervision, and their condition is substantially deteriorating, and or that intervention is needed to help prevent relapse or deterioration. Next slide, please. So in terms of diagnosis, the individual must have a diagnosis of bipolar 1 disorder with psychotic features, schizophrenia spectrum disorders, or other psychotic disorders, which we're going to talk about more in the next slide. If there is not a current diagnosis documented, you're able to work with historical diagnoses, provisional diagnoses, and diagnostic impressions using things like medical records, clinician assessments, or relevant documentation to help determine what might be a good provisional or historical diagnosis that can be used to help determine eligibility for care. Next slide, please. And so eligible diagnoses are to be based on the criteria in the latest DSM edition. And the focus is on conditions where psychosis is a significant feature, although the pattern and context might differ. And so the eligible diagnoses include the range of schizophrenia spectrum and related psychotic disorders, as well as bipolar 1 disorder with psychotic features. And it's important to refer to the full care eligibility criteria to be inclusive and informed on any diagnoses that may not be eligible under care. Next slide, please. So a qualifying diagnosis is only part of the criteria. It's important to know that diagnosis alone is not enough to determine care eligibility. The court will need to determine whether or not Ming meets eligibility requirements, including having symptoms that are severe in degree and persistent in duration, symptoms that may cause behavioral functioning issues that interfere substantially with primary activities of daily living, symptoms that may result in an inability to maintain stable adjustment and independent functioning without the intervention of treatment support and rehabilitation for long or indefinite periods of time. We need to see that participation in care will be the least restrictive alternative that's necessary to ensure a person's recovery and stability, and that it would be likely that a person will benefit from participation in care in terms of a care plan, care agreement, engagement, and care-related services. And we also need to see that at least one of the following is true, that the person is unlikely to survive safely in the community without supervision, and that the condition is substantially deteriorating, and or that the person is in need of services and supports to help prevent a relapse in symptoms or deterioration that is likely to result in a grave disability or serious harm to the person or others. Next slide, please. So a key element that supports eligibility is making sure that the person is in fact experiencing a serious mental disorder. This refers to severe and persistent mental conditions that significantly disrupt daily life activities. So the idea of severe and persistent is where we take into consideration how how intense the symptoms are. So if a person is having very significant hallucinations, if they're experiencing paranoia or delusions, if they're having speech that's disorganized, behaviors that are disorganized or unsafe, if they're having trouble with insight or judgment, all of these things kind of play into the full scope of whether or not the mental disorder is severe. In terms of whether or not the disorder is persistent in duration, we want to look at how long ago the symptoms started, how long they have been observed, and when a diagnosis was first made, or when a diagnosis may have been able to be made based on the onset of symptoms. We also want to look at whether the symptoms are interfering with daily living. And here, some key examples of behavior that may be interfering with daily living include interrupting a person's ability to participate in self-care activities, being able to bathe or groom themselves, dressing appropriately for the weather, having significant fluctuations in weight, having medical conditions that aren't managed, and just having trouble day to day with functional tasks like transportation, managing their money, accessing food or medical care. And then the third supporting assertion for a serious mental disorder is that without treatment, support, and rehabilitation, the individual won't be able to maintain stability or independent functioning. And so here we look at things like housing instability, challenges with social or community functioning, issues with law enforcement or emergency departments, and things like that. And so each of these three areas are really important to help truly define whether or not a person is experiencing a serious mental disorder. So when we're thinking about Ming, let's consider whether or not she's stabilized with ongoing treatment. If a person's not stabilized with ongoing voluntary treatment, that can mean a couple of things. So perhaps Ming is declining services consistently or intermittently. Maybe her current treatment plan is not effective at stabilizing her condition. And to be eligible for care, it's required that a person is not clinically stabilized in ongoing voluntary treatment. If an individual is stabilized in involuntary treatment, such as LPS conservatorship, they cannot be considered stabilized in ongoing voluntary treatment. And so we are considered clinically stabilized if the person's condition is stable and that they're actively participating. And so if a person is in voluntary treatment, but their symptoms are getting worse, if they are not stabilized, if they're still having issues with daily functioning, then it is possible that they would be eligible for participation in care. Next slide, please. If a person's condition is deteriorating, this means that they are unlikely to survive safely in the community without supervision, and that the individual's condition is getting worse. And so we're seeing things like recent or frequent or increasing hospitalizations or arrests. And also in terms of deterioration, we define that as saying that services and support might be able to prevent that person having a relapse or an increase in symptoms. It may interrupt the deterioration that they're experiencing and hopefully prevent them from experiencing grave disability or harm to self or others. And so this definition of deterioration is really important as we're considering whether or not a person might be eligible for care. Next slide, please. We also want to make sure that participation in care is the least restrictive alternative. This means that the care process offers a solution that provides necessary support and intervention without resorting to more restrictive measures like involuntary hospitalization, conservatorship. A care agreement and plan really works to emphasize collaboration and choice, allowing the person to participate in the recovery while they're living in the community. Provided that in the community they are able to receive the appropriate services and support that they need to be able to get stabilized. Another key element is that the individual is likely to benefit from care, meaning that the services and support that are part of care are the right intervention for this individual. Care is designed to help increase stability, improve quality of life, and reduce the likelihood of crisis through targeted evidence-based care. And so these additional requirements are really, really important that we are evaluating and documenting as we are doing our due diligence to make sure that a person truly is fit for participation in care. Next slide, please. Now, as we're talking about eligibility, we do want to touch base on a few common myths or misunderstandings that people might have about care eligibility. The first one is the belief that if someone has not been held on two 5250s or involuntary hospitalizations, that they are not eligible for care. The fact is that declaration, evidence, or other documentation of at least two 5250s, one which is within the previous 60 days, is just one possible option to support a petition form, but it is not required as a component for eligibility. The second common myth that we see is that someone enrolled in outpatient treatment is not eligible for care, when the reality is that an individual who is participating in ongoing voluntary treatment may very well be eligible for care if they are not stabilized and if they meet the rest of the eligibility requirements. The third myth is that substance use automatically disqualifies somebody from care. The fact is that a substance use disorder can't be the standalone diagnosis when considering eligibility, but they can be co-occurring with an eligible diagnosis of bipolar 1 disorder with psychotic features, schizophrenia spectrum disorder, or other psychotic disorders, such as substance or medication-induced psychotic disorder. And so these myths and facts are really important to get familiar with as you are evaluating the eligibility of folks that might be appropriate for care, to make sure that we truly understand what does or does not make someone eligible for the CARE Act. So on the next slide, let's come back to Ming and find out whether or not we feel like she meets criteria. And I'd like to kick this over to my colleague, Dr. Rose. Dr. Rose, you've heard a lot of details, a lot of information about eligibility. What are your thoughts in terms of whether Ming might meet criteria for care?
Yeah, that's great. Thank you, Rachel, and thank you for having me here. Good to see you and Patricia today. So when we consider all of the things that you just talked to us about, the deciding factors that need to be carefully reviewed, it may appear at first glance that Ming meets eligibility criteria for care. So let's just go through those really quickly. Does she have a qualifying diagnosis? Well, it appears that she carries a diagnosis of schizophrenia. You mentioned she was diagnosed earlier when she was about 18. Her symptoms have been severe and persistent. They've been impacting her ability to work, where she lives, their relationships. We know that when she's unmedicated, her behavior is erratic. Certainly, it appears that she has a high risk of not surviving safely in the community. She's been wandering at night. She's been becoming increasingly paranoid about the owners of the board and care that she's at. And those delusions are really impacting her ability to live there safely. Seems like her condition is deteriorating. We've seen that she's potentially at loss of her B&C housing because of the interactions that she's having with other folks there, with the owners, with the caretaking, and then certainly multiple visits recently to the emergency room. And so last, the question is, would this be least restrictive services compared to some alternatives? This very well may be the least restrictive alternative. CARE could potentially bring her the kinds of resources and treatment that would benefit her to live independently with a little bit of structure in the community. So what we know now is that it appears that Ming meets or may meet criteria. So why don't we go through it a little bit more in detail and figure out how we would get through that process to make that determination. So I'm going to take it from here if that's okay with you, and I will ask if you can advance to the next slide. I think that we are there. Thank you. So Rachel was good and showed us an overview. I'm going to bring us back there just as a quick refresher. Really eligibility, despite what I just said, that it appears that she meets eligibility. Ultimately, it really is up to other people. And so we're going to talk about those 3 points at various times that we'll consider eligibility. So let's jump into them as we go forward. Next slide, please. So different points along this workflow, we're going to look at the petition, what's first submitted to the court. We will look at the county report, and I'll talk about that in a little bit more detail. And then we will look at the clinical evaluation. All of these, again, touch points where the individual, in this case, Ming's eligibility for care may be considered. Moving to the next slide, please. So I've talked about these 3 different points. I'm going to make a few high-level comments. You can learn a lot more. We have other trainings. We certainly have a training that Rachel has done on assessment in care. I would ask that you look there for a lot more detail. But here we have the petition, the county report, and the clinical evaluation. Each of these I'll turn to in more detail in my future slides, but just a couple of notes that the petition could be filed by a family member or others, or it could be the county behavioral health agency. And that's the initial form that's used by the court to determine if prima facie, that's if the person appears at first glance to meet eligibility. And so that's that initial touch point. And again, I'm going to discuss this in a lot more detail. Following the prima facie and hearing on the merits, the county report. That's where if the petitioner is somebody other than the county, if it's not the county Department of Behavioral Health that filed it, it's the court's way of asking for more information. There's an assumption that county BH may be new or not so familiar with the respondent. And so in this case, the court asks the county to do their investigation to determine if they think the person meets or may meet eligibility. In the case management hearing where a clinical evaluation is done, is really if it seems that the individual, the respondent, and others aren't coming to a place of agreement where they're in alignment on what might be put into a care agreement. So in this case, an evaluation may be done by licensed behavioral health professional to look at perhaps if a care plan is appropriate. So those are the three. Why don't we break it out over time a little bit more detail? Move to the next slide, please. So here, the petition, the information, what goes into it. Again, this is the first touch point. Does the person appear to meet or may meet criteria? Here's where the petitioner is essentially saying that it's in their best belief that the respondent does meet criteria. It'll be looking at things like the diagnosis, whether it's bipolar 1 with psychotic features or diagnosis along the schizophrenia spectrum. Looks at behaviors, mental state, whether somebody is attending to their ADLs, their activities of daily living, how they maintain a job or a residence or a relationship with other people. And it may also be looking at adherence to medication, or if somebody is involved in treatment and despite that treatment or even despite the medication, perhaps that treatment isn't helpful in helping the individual to stabilize. So in all of this, the petitioner is essentially attesting that they think that the person meets eligibility criteria. So this is their first place where we're talking about who the person is, along with what their strengths are, and perhaps what some of the concerns are by the individual who is completing and submitting the petition to the court. So let's take a look at how the petition is used by the court to determine eligibility. The court will make a prima facie determination, and prima facie on its face value, on its appearance. This is the place where a judge, he or she will determine that the person meets or may meet care eligibility. So if the court determines that the person does meet eligibility or has met the criteria for this determination, a couple of things could happen. If the county behavioral health agency is the petitioner, the court can schedule a hearing, and it could ask the county to provide more information to supplant the court's understanding. Certainly, if the person appears to have passed prima facie and the petition was filed by somebody other than the county, let's say perhaps that it was a family member or a treating doctor, the judge will order the county to provide additional information in the form of a court report, a county report to the court. So that is the second place where eligibility could be determined. Important to note that if the court here determines that the individual does not meet care eligibility based on all of this information, the case may be dismissed. Again, though, the court can ask for additional information at that point. Let's go forward to the next one. And here you've heard me talking about the county report, so in a little bit more detail. Generally, this is happening if the petitioner is not the county behavioral health agency. Again, it could happen otherwise, but in this case, the court will order the county to complete an investigation and to file a report talking about the person if they believe he or she meets eligibility, any outcomes and any efforts to engage the person. The court would really like to see what types of outreach efforts have been made and if the person has been responsive to these outreach efforts, and then certainly conclusions and recommendations that the county will make in the report. So again, even if it is the county behavioral health agency, the court may request more information, and that's happening and that we are hearing in a number of courts. So why don't we move forward? Thank you. And as we said at the end of this, and I'm past the county report right now, the court, one of a couple of things will happen. The court will do one of a couple of things. The court will either dismiss the case if voluntary engagement has occurred. And so this is where the county is saying, I have met with the individual, perhaps let's use Ming. I've met with Ming. She is responsive to getting some services. She's interested in meeting with us. She's interested in working with a care manager to help help improve things at the boarding care, for example. Well, in this case, she's voluntarily engaging, she's on board. The court may dismiss the care petition at that point, deeming that voluntary engagement has been effective. If the county does not make a showing that prima facie has been met, perhaps the individual doesn't have the diagnosis or meet the diagnostic criteria, the court may choose to dismiss the petition. And then finally, if it's determined that, again, the person appears to meet criteria, the court can set a hearing date on the initial appearance. And at that point, the petitioner, the respondent, the appointed counsel, the county, behavioral health, will, or in this case where Ming meets, will be asked to attend the initial appearance hearing. I think that we can continue. Thank you. And so here, initial appearance, we're talking about it in a little bit more detail. I've mentioned before that this can be combined with the hearing of the merits, and I do understand that that's frequently happening. It's one less court case or one less time for these decisions to be made when they're joined together. And typically here, the petitioner, the respondent, county behavioral health agency, and certainly counsel will be present. The respondent could choose to waive their appearance, but certainly county counsel and the individual respondent's counsel would be present. And usually these are fairly quick determinations. So at this time, the court will make a determination by clear and convincing evidence that the respondent meets the eligibility criteria, and certainly they will consider evidence that has been presented to reach that determination. Let's move on to the case management hearing. I'm not going to spend a lot of time on that here because we do have lots of other trainings. The goal of this hearing is to determine if a care agreement can or cannot be reached. And again, if it is unlikely to be reached, in this case where the individual respondent isn't so on board with what that plan might look like, the court could order a clinical evaluation. Let's take a quick look at what that clinical evaluation may be. So at this point, it's been seen that perhaps Ming is not in agreement with what kinds of services should be received by her. And so because there's no agreement between the county and the court and the respondent, the court may order a clinical evaluation. This is an evaluation that's done by a licensed behavioral health professional to basically assess if a care agreement is unlikely. And then we'll look at a clinical diagnosis. They'll look at the individual's capacity to give informed consent regarding medication, specifically psychotropic medication. They'll look at other relevant information that's helpful to the court. And basically, we'll provide some recommendations of housing programs, medication, individual services, or other things that might be helpful to support the respondents to live safely in the community. And again, what we're seeing here is the process of the clinical review hearing. The court will determine their finding of the person meeting the criteria or not, having looked at all of the other evidence that has been submitted by the court and perhaps submitted by the respondent and their counsel. Only relevant and admissible evidence that fully complies with the rules of evidence can be considered by the court. So at this point, the respondent meets criteria. That determination may be made, or the fact that the respondent does not meet criteria. And again, this is where a second point where the case may be dismissed. Assuming that criteria has been met and the court does determine that Ming is eligible for care, then at this point, Ming, her counsel, and the county will come up with a care plan, and that will be reviewed no later than 14 days. As we shift over to reappointment to care, and we do have multiple trainings and other information on our website that you can check out for more detail, though that there is another time where if the individual is being considered for reappointment to care, this is typically for 1 year after a care plan, then the person does need to continue to meet care eligibility criteria in order for that reappointment to occur. So with that, I'm going to bring Rachel back, and I'm going to ask you, it's your turn. You've talked a lot about what goes into eligibility determination, and I've talked a little bit about the court proceedings to support that eligibility. I'm wondering if you want to talk a little bit about what are some of the areas that you think we need to be considering, or what questions would you walk away from this training with?
Thank you, thank you. I think one of the biggest and most important aspects of all of this is really, really making sure that we have done our due diligence to ensure that the person does in fact meet eligibility and is, as part of that eligibility criteria, number one, a fit for the program, and number two, likely to benefit from participation in care. Making sure to help honor and protect the eligibility of that person, to make sure that it is a fit, is a really big responsibility of all the people that are involved in the care process. And then similarly, I think it's really important to also really understand the roles of all of these different people that have touch points with the individual and that are involved in care. And so just if I could for just a moment, I wanted to talk about some of the primary players to make sure that folks are clear on that.
That'd be
The
great.
first is the client and the respondent themselves. And so that's the individual that is the subject of the CARE Act proceedings and who we are hoping to help through involvement in the CARE Act. Typically somebody experiencing a serious mental disorder, as we've talked about, that is eligible, that is not yet stabilized with treatment. And it is important to know that a person can actually file a petition on their own behalf and include elements that they believe might make them eligible for participation in care. And so it's kind of cool to know that the client or respondent is able to also be the petitioner.
Mhm.
And so the petitioner is the person that or entity that initiates the CARE Act process by filing a petition that includes as many facts as they are able to include that support the person's eligibility. And so the petitioner is responsible for providing as much information that they can in the petition that helps the court make an initial determination about whether or not that individual may be eligible. We have the county behavioral health agency, who actually can also be a petitioner and would therefore need to be able to provide sufficient evidence around eligibility criteria in the petition. County behavioral health is also responsible for investigating and filing a report if the petition was anyone other than county behavioral health, or if the court requests more information. We also, of course, have the judicial officer, which is who reviews the reports, determines eligibility, and ensures that the process is followed correctly. And so, what's really important in care is we have all these different parties working together to make sure that the eligibility for the individual is met, and that we are honoring their choices, respecting their dignity, operating in a trauma-informed manner as we're going through all the steps to determine eligibility, and that we're all really working to be in lockstep to make sure that we really do believe that care is the least restrictive environment for this person, and that it is likely to be able to help them start to feel better. And with that, I will kick it back over to Patricia.
Thanks, Rachel. Thanks, Deborah. Again, the goal of this session is that you would have an increased ability to describe care eligibility, including the clinical diagnosis and other eligibility related to impact on daily living, and also identify those key inflection points, which Deborah went over throughout the care process in which eligibility is assessed and evaluated. including the petition, the county report, and the clinical evaluation with the brief look at reappointment and how eligibility applies. We are here to support you and connect you with resources. So if you have any questions, the full notes are in the training resources, but you can also reach out to info@careact.org and someone will get back to you and connect you with an answer and different trainings and resources. Thank you.